Hi, today we are here to talk about health screening and we have with us here Dr. Melissa Chan from Thomson Specialists. So, Dr. Chan, could you share with us for ladies at different age group from 20s, 30s, all the way to 50s and beyond, what are the key tests that we should take note of during our health screening at different stages?
So from age 20s, we generally start off with cervical cancer screening. As part of the national screening program, women aged 25 to 29 are advised to start pap smear screening, and this would actually change to human papillomavirus testing from age 30 onwards. This test will be done once every 5 years up until age 69, but based on discussion with their doctor, the screening may be extended further beyond that. We also start with breast cancer screening at age 40. Yearly mammogram screening is generally recommended, but because of the density of breast tissue, other tests such as ultrasound breast may also be recommended. From age 50 onwards, as part of breast cancer screening, women should continue to undergo mammogram screening at least once every 2 years. So, chronic disease screening is also recommended from age 40 onwards. This would include screening for high blood pressure, what we call hypertension, high cholesterol, so hypercholesterolemia, as well as type 2 diabetes. So, screening for these may actually be done at an earlier stage if there are any potential risk factors, including whether there is a family history for it, whether there is a smoking history, whether the person is overweight as well. So one more test that women are also advised to continue doing would be also in their 50s for colorectal cancer screening. This can either be done with a screening colonoscopy or with a stool for occult blood testing.
Now, Dr. Chan, you mentioned risk factors earlier on. What are some of the key risk factors that ladies at different age groups should take note of?
Abnormal uterine bleeding in between periods would be something to take note of. Postcoital bleeding is another thing to be monitoring for. If they have multiple sexual partners, screening at earlier age, monitoring for any vaginal discharge would be one of the important things to be watching out for as well. Family history is another thing to be aware of, especially, for example, in the case of breast cancer. So having a first-degree relative who has been diagnosed with breast cancer, especially at early ages, should prompt them to do earlier screening. For chronic disease screening, on the other hand, other factors would include their weight, whether they have any smoking history, how much alcohol they are taking. All these would be important factors to help us decide how early they should start screening as well.
With so many preventive health screenings on the market available, how can women take a more proactive approach when it comes to all these health screening?
So first things would be, as I mentioned earlier, being aware of their own family history, keeping track of their own health. So if they've ever seen a doctor previously, they should keep in mind about what previous test results they've had, whether there were any abnormalities that were flagged up to them, and whether they need to be followed up on. Other things is also being aware of national guidelines on what areas should be screened, namely, as I mentioned earlier, cervical cancer screening, breast cancer screening, colorectal cancer screening, as well as screening for chronic diseases would be the important things that we follow up on. If they are predisposed to certain medical conditions, they should have a discussion with their doctor on whether they should have additional tests performed at an earlier age.
So based on what you have shared, it's actually really important for us to take responsibility and accountability of tracking our own health besides maintaining a healthy lifestyle. If we do observe anything different from our usual body condition, how do we prepare ourselves for health screening?
So for health screening, patients are generally advised to fast for at least 8 to 12 hours before the test. They can alternatively have sips of water, but generally no food. If they are taking any medications before the health screening, they should clarify with the clinic whether they can continue these medications even the night or the morning before of the health screening.
So what about supplements? If we have been regularly taking supplements, would that affect the health screening?
In general, most supplements should not affect health screening results. But certain types of supplements, say if you are doing screening for iron levels, taking iron supplements before the health screening may potentially affect the results. So do check with the clinic on whether you can continue taking them or whether you are running those specific tests.
That's really great to know. So before we conclude, Dr. Chan, what would be some words of advice that you have for our viewers who are concerned or who are reluctant to go for their first health screening?
So first of all, most important thing is to be aware of what tests would be recommended for your age group. Staying aware of national screening guidelines would be the first most important thing. Another thing to remember is that even if you feel well and if your previous health screening tests have been normal, that's not a reason to avoid going for your routine health screening. Early detection of diseases via health screening would likely help to provide more treatment options at reduced costs.
So thank you so much, Dr. Chan, for spending time here with us today.
Thank you.